Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Medical education in discourse analysis. Interactive assistant medical education refers to the structured process by which future healthcare professionals are trained in the knowledge, skills, and attitudes required to practice medicine. In discourse analysis, medical education is examined to understand how language shapes the transmission of medical knowledge, professional identity formation, and the development of clinical skills. The way that medical concepts, ethics, patient communication, and professional values are taught reflects and reinforces broader societal expectations and institutional norms within healthcare. Discourse analysis of medical education investigates the power dynamics between teachers and students, the role of language in clinical training, how medical jargon is introduced and normalized, and how future healthcare providers are socialized into the profession. This type of analysis can reveal implicit assumptions about hierarchy, gender, culture, and professionalism in medical training, and it can offer insights into how language both reflects and constructs the professional identities of doctors and other healthcare professionals. Key features of medical education in discourse analysis. 1. Socialization into medical culture. Discourse analysis in medical education examines how students are socialized into the culture of medicine through language. This includes how they are taught to speak about patients, illness, and treatments, as well as how they are encouraged to adopt specific professional attitudes, such as objectivity, detachment, and compassion. Example: in medical education, students may be taught to refer to patients as cases, or describe medical conditions in technical, impersonal terms. Discourse analysis would explore how this language socializes students into a professional culture that values clinical detachment, while potentially depersonalizing patients in the process. 2. Power dynamics and hierarchy. Medical education is often characterized by a hierarchical structure, with clear power differentials between attending physicians, residents, and medical students. Discourse analysis investigates how these hierarchies are maintained and reinforced through language, whether through deference, questioning, or feedback exchanges. Example: in clinical rounds, medical students might use deferential language when addressing attending physicians, such as, "Dr. Smith, may I ask a question?" Discourse analysis would examine how this language reflects the power dynamics between students and senior medical staff, as well as how students navigate these hierarchical relationships while learning. 3. Clinical reasoning and case presentations. One of the central components of medical education is learning how to present and discuss clinical cases. The language used in these presentations is highly structured and reflects the priorities of the medical field, such as diagnostic reasoning, objectivity, and clarity. Example: in a case presentation, a medical student might say, "The patient is a 65-year-old male with a history of hypertension, presenting with chest pain." Discourse analysis would focus on how the language emphasizes key medical details, follows a standardized format, and reflects the values of precision and diagnostic reasoning in medical training. 4. Use of medical jargon and technical language. In medical education, students are introduced to and expected to master complex medical jargon and technical terms. Discourse analysis examines how this language is taught and normalized, and how it shapes students' understanding of medicine as a specialized, scientific field. Example: in a lecture on cardiology, an instructor might introduce terms like ventricular fibrillation or atrial septal defect. Discourse analysis would explore how medical jargon is used to convey complex concepts and how it separates medical professionals from laypeople, creating a specialized discourse community. 5. Ethical and empathetic communication. Discourse analysis in medical education also focuses on how students are taught to communicate with patients empathetically and ethically. This involves learning how to convey bad news, explain medical procedures, and discuss treatment options in ways that are both compassionate and clear. Example: in a communication skills training session, medical students might be taught phrases such as, "I understand this is difficult news," or "Let's work together to find the best treatment option for you." Discourse analysis would examine how these phrases are used to teach empathy, trust building, and patient-centered communication in clinical practice. 6. Constructing professional identity. Medical education plays a crucial role in the formation of a healthcare provider's professional identity. Discourse analysis investigates how language shapes the way medical students come to see themselves as professionals, how they adopt the norms of the profession, and how they internalize the responsibilities of being a doctor. Example: in medical ceremonies, such as white coat ceremonies or oaths, students may recite professional pledges or hear speeches about the ethics of medicine. Discourse analysis would explore how these formal discourses construct an identity centered around values like compassion, responsibility, and lifelong learning, reinforcing students' sense of belonging to the medical profession. 7. Feedback and evaluation. Medical education involves continuous feedback and evaluation from instructors and peers. Discourse analysis examines how feedback is delivered, focusing on the language used to assess students' performance, guide improvement, and build competence. Example: an instructor might say to a student after a clinical procedure, "You did well with the diagnosis, but next time, try to explain the treatment plan in simpler terms so the patient can understand better." Discourse analysis would explore how the feedback reflects pedagogical goals, professional expectations, and the instructor's position of authority. Methods for analyzing medical education in discourse. 1. Critical discourse analysis, CDA. Critical discourse analysis, CDA, is used to explore how power, ideology, and social structures are reflected in medical education discourse. CDA focuses on how language in medical training reflects and reinforces hierarchies, professional norms, and societal expectations. Example: a CDA of feedback sessions in medical training might reveal how attending physicians maintain authority over students by using directive language and how this reinforces the hierarchical nature of medical education. The analysis would also explore whether students are given opportunities to challenge or question authority. 2. Conversation analysis. Conversation analysis is useful for examining the structure of interactions between students, instructors, and patients. This method focuses on turn-taking, question sequences, and how participants manage conversations during clinical training and classroom discussions. Example: conversation analysis of clinical rounds might reveal how medical students position themselves as learners by asking questions, while attending physicians maintain control of the interaction by providing explanations or corrections. The analysis would explore how these conversational patterns shape the learning process and reflect professional hierarchies. 3. Ethnographic discourse analysis. Ethnographic discourse analysis combines ethnographic observation with discourse analysis to study how language is used in real-world educational settings. This method is particularly useful for examining how medical students interact with patients, instructors, and peers in clinical environments. Example: an ethnographic discourse analysis of medical simulations might investigate how students practice delivering bad news to patients. The analysis would focus on how students navigate both the technical and emotional aspects of the interaction, using language to balance professionalism with empathy. 4. Narrative analysis. Narrative analysis focuses on how medical students and educators construct and interpret stories about medical practice, professional experiences, and ethical dilemmas. This method is particularly useful for exploring how students make sense of their learning experiences and how they internalize professional values. Example: in reflective writing assignments, medical students might share stories about difficult patient encounters or challenging diagnoses. Narrative analysis would examine how these stories help students develop their professional identity, grapple with uncertainty, and reflect on the human side of medicine. Examples of medical education in discourse analysis. Example 1. Hierarchical language in clinical teaching. During clinical rounds, medical students, residents, and attending physicians often engage in hierarchical communication, with senior physicians guiding the interaction. Discourse analysis would explore how students use deferential language, such as, "I think the patient might have," rather than making definitive statements, to reflect their subordinate role. The analysis would focus on how language reinforces the hierarchical structure of medical education and how students navigate their position within it. Example 2. Teaching bedside manner. Medical schools often include courses on patient communication and bedside manner, teaching students how to convey empathy and build rapport with patients. Discourse analysis of these courses would examine how instructors model compassionate language, such as, "How are you feeling today?" and "What concerns you most about this procedure?" The analysis would focus on how language is used to train students in patient-centered care, and how it reflects the values of empathy and trust building in healthcare. Example 3. Normalization of medical jargon. As students progress through medical education, they are introduced to increasingly complex medical jargon. Discourse analysis might examine how this jargon is gradually normalized in case discussions, lectures, and exams. For example, terms like hypertension or ischemia might initially be explained in lay terms but later used without explanation as students advance. The analysis would explore how this process reflects the professionalization of medical students and their integration into the medical community. Example 4. White coat ceremony and professional identity. The white coat ceremony is a symbolic event in which medical students are presented with their first white coats, marking their entry into the medical profession. Discourse analysis would focus on the language used in speeches and oaths during the ceremony, such as phrases like dedication to the service of humanity or commitment to ethical practice. The analysis would explore how these ceremonial discourses construct professional identity and reinforce the values of compassion, ethics, and responsibility. Example 5. Feedback in simulation-based learning. Simulation-based learning is a common pedagogical tool in medical education, allowing students to practice clinical skills in a controlled environment. Discourse analysis of feedback sessions following simulations might examine how instructors use language to assess student performance, for example, by saying, "You were clear in your instructions, but you could have been more empathetic with the patient." The analysis would explore how feedback balances technical competence with communication skills, and how it contributes to the student's development as a well-rounded healthcare provider. Challenges in analyzing medical education through discourse. 1. Institutional hierarchies. Medical education is deeply hierarchical, with power dynamics influencing how language is used in teaching and learning. Discourse analysts must carefully navigate these hierarchies to understand how they shape communication, often focusing on subtle expressions of authority or deference. 2. Technical language. The use of technical medical language can make discourse analysis challenging, as it requires a deep understanding of medical terminology. Discourse analysts must either have or develop expertise in medical jargon to accurately interpret the language used in educational settings. 3. Implicit norms and values. Much of the professional socialization in medical education involves implicit norms and values that may not be overtly expressed in language. Discourse analysts must look beyond what is explicitly stated to understand how these norms are communicated and internalized through everyday interactions and institutional practices. Conclusion. Medical education is a rich field for discourse analysis, as it involves the transmission of knowledge, the formation of professional identity, and the negotiation of power dynamics within a highly structured environment. By analyzing how language is used in lectures, clinical training, case presentations, and patient interactions, discourse analysis provides valuable insights into how medical students are socialized into the profession, how they learn to communicate effectively, and how they navigate the complexities of medical culture. Whether focusing on the use of medical jargon, the role of feedback, or the construction of professional identity, discourse analysis helps illuminate the ways in which language shapes the educational experience and the development of future healthcare providers. Frequently asked questions. What does discourse analysis in medical education focus on? Discourse analysis in medical education examines how language influences the teaching, learning, and professional identity formation of healthcare providers. It looks at how students are socialized into medical culture, the role of jargon, power dynamics, ethical communication, and professional values. How does language shape power dynamics in medical education? Medical education is hierarchical, with power typically favoring attending physicians and senior staff over students. Discourse analysis reveals how language maintains these dynamics, showing, for example, how deferential phrases used by students underscore their lower position in this structure. What role does socialization play in medical education discourse? Socialization involves teaching students the professional language and values of medicine. Discourse analysis explores how students are introduced to technical terms and clinical detachment, shaping their identities as medical professionals and reinforcing values like objectivity and compassion. How is medical jargon introduced and normalized in medical education? Medical students learn jargon in lectures and case discussions, where terms like tachycardia or atrial fibrillation become normalized. Discourse analysis examines how jargon separates medical professionals from laypeople and creates a specialized community, reflecting a gradual integration into the medical field. Why are clinical case presentations significant in discourse analysis? Case presentations are fundamental in teaching diagnostic reasoning and clear communication. Discourse analysis of case presentations focuses on how students structure and prioritize medical information, reinforcing the values of precision and objectivity in medical training. How are empathy and ethical communication taught in medical education? Empathy is taught through specific language techniques in patient communication training. Discourse analysis examines phrases like, "I understand how you feel," to show how empathy and ethical practices are modeled, aiming to enhance patient-provider rapport and trust. How is professional identity constructed in medical education? Medical ceremonies, such as the white coat ceremony, play a crucial role in professional identity construction. Discourse analysis focuses on how oaths and speeches use language to instill values like ethics, compassion, and dedication to service, reinforcing a sense of belonging in the medical community. What is the impact of feedback in medical training? Feedback provides guidance and reinforcement of professional standards. Discourse analysis explores how feedback is phrased, focusing on the balance between technical and communication skills, such as advising on empathy alongside diagnostic accuracy. How does conversation analysis apply to medical education? Conversation analysis studies the structure of dialogues, such as turn-taking and topic management in clinical rounds. It examines how students use questions and how instructors maintain authority, shedding light on interaction patterns that support the educational process. What challenges arise in analyzing medical education discourse? Challenges include navigating institutional hierarchies, understanding complex medical terminology, and identifying implicit norms. Discourse analysts must carefully interpret technical language and be aware of the social context to fully understand the communicative subtleties in medical education.